Now, how does influenza cause illness to us humans? The virus spreads from person to person by airborne droplets or by contact with contaminated hands or fomites. Signs and symptoms of the disease may not appear until after the first 1 to 4 days after infection. So, this is the incubation period. And it also depends on the size of the viral dose and the immune status of the host. I already mentioned earlier, no, that as early as 3 hours after infection, the virus will have already taken over host cells that it has entered. Okay? Viral shedding actually starts 1 day before the host produces symptoms of the disease. And this peaks within 24 hours, remains high for the next 1 to 2 days, and declines over the next 5 days. So, mga around a week or so. By the way, when we say viral shedding, this refers to the release of the new progeny viral particles capable of infecting more cells. Okay, and this may also refer to the time when the host is contagious, meaning you are already contagious 1 day before you even feel sick. Okay, until around 1 week after the onset of symptoms. Actually, initial defenses against the influenza virus are the cough reflex, if it is able to effectively remove virus particles. The virus can also be neutralized by pre existing specific IgA antibodies, and it can also be inactivated by non-specific inhibitors that are present in the mucous secretions. However, if they are able to evade these mechanisms, they can now deposit and infiltrate susceptible cells. The neuraminidase proteins are also able to lessen the viscosity of the mucous film in the respiratory tract. No? So this allows the sialic acid receptors to be readily available for viral hemagglutinin proteins to attach to. And this also allows virus containing fluid to spread to the lower portions of the respiratory tract. By the way, it only usually affects the respiratory tract. Why? Remember the hemagglutinin protein? Diba? Remember, it has two subunits, HA1 and HA2, right? This should be split or cleaved from each other, okay? And to activate and expose the fusion peptide. And I mentioned that the splitting is facilitated by specific proteases. Diba? Now, these proteases are the human airway trypsin-like protease, or the HAT, and the transmembrane protease serine S1 member 2, or TMP-SS2. And guess what? These proteases can be found only in the human airway. So that's why only the respiratory tract is usually affected. In other areas without these proteases, the flu virus is actually non-virulent, except, okay, diba? Always na exception, except the H5 and H7 bird flu strains, which can actually be cleaved by proteases that are produced in many different tissues of the body of birds and probably also humans. So this probably explains why scientists found H5N1 bird flu to replicate outside the human respiratory tract, no? But for the other strains, they are restricted to the respiratory tract. So influenza causes respiratory symptoms, coryza or runny nose due to the less viscous mucus discharge, di ba? And then sore throat and cough because the virus also directly damages the superficial mucosa of the respiratory tract. And of course, inflammation occurs. So edema, infiltration of WBCs, release of cytokines, and cell death. Okay? The systemic symptoms are actually a result of the body reaction to the release of cytokines and other inflammatory mediators. So that's why there is fever, chills, and headache. Actually, infection with the flu virus can be uncomplicated, no? Presenting only with chills, headache, dry cough, sometimes fever, malaise, and loss of appetite. Usually, this is self limiting, and the fever lasts only about 3 to 5 days. But the respiratory symptoms can extend another 3 to 4 days more. Actually, the cough can persist for 2 to 4 more weeks after the major symptoms subside. Okay? So, kung uncomplicated. But influenza can also cause serious disease due to its complications, especially in elderly adults, in very young children, no, mga extremes of life. Okay? And those with comorbidities or coexisting diseases like lung or heart problems, diabetes, cancer, and immunosuppression, where their bodies cannot cope up with the damage caused by the virus and the body's reaction to the virus. In children, it is an important cause of croup or laryngotracheobronchitis, which can be severe, especially in children less than 1 year old. Okay? So, have you heard the classic sound of the cough in crew? Crew, crew. Joke lang. It produces the classic high-pitched barking cough, no? Like a seal's bark. I-search na lang ninyo sa YouTube I will dili na ako mag-example. Okay? So aside from the barking cough, you also have the children with crew also have hoarseness. Dili sound sa horse Hoarse kanang croaky or gruffy voice or paos kana. And stridor, which is a result of upper airway obstruction. Okay? So inspiratory stridor. So influenza is dangerous because, like I said, it causes damage to the respiratory epithelium, right? And because of this, it lowers the resistance of the respiratory tract to other infections. So like bacterial infections, especially Staphylococci, Streptococci, and Haemophilus influenzae. Okay? So this is because there is now loss of ciliary clearance, right? And then there is dysfunction of phagocytic cells, and also the alveolar exudate or the pus makes a rich growth medium for bacteria to proliferate. So aside from just a flu, you can also have a secondary bacterial infection and even another viral infection pag yun, okay, at the same time. And another important complication found in children and adolescents from 2 to 16 years old is a syndrome that presents with encephalopathy with a high mortality rate. This is your Rice syndrome, which is even more likely to happen if you give aspirin to these children. Remember? Okay, so how do we diagnose influenza infection? Clinically, or using the clinical characteristics, is not accurate. This is because a lot of viruses can cause respiratory and systemic signs and symptoms like that manifested in influenza infection, right? So technically, we cannot say that a patient has influenza infection if we did not do laboratory tests to confirm the presence of the virus, right? We can only say that the patient has symptoms that are like that produced by an influenza. So that's why we have the clinical diagnosis influenza like illness. But if we really need to know, then we have to resort to lab diagnostics. Specimens should be obtained within 3 days after the onset of symptoms by either nasopharyngeal swabs, nasal aspirate, or lavage fluid. RT-PCR can be done to identify the presence of viral antigens or viral nucleic acid. So this is the preferred test because it is fast. No? You get the results within the day. And it is sensitive, meaning it can correctly identify those with a disease. Or, in other words, if you get a positive test result, you are most likely to really have the disease. And it is also specific, meaning it can correctly identify those without the disease. Or, in other words, if you get a negative result, then most likely you really don't have the disease. You can also do cell culture if you want to isolate the virus, no? Maybe if you want to study the strain characteristics. And there are also serologic tests that show the body's specific immunologic response, particularly the presence of specific antibodies. Okay, but since normal people can also already have influenza antibodies, the titers should be increased more than 4 times, okay, to say that the person might be having a flu infection. Okay, so treatment. There are certain antiviral drugs that can be used to affect the virus, no? Targeting specific proteins and thereby the functions of those proteins in the life cycle of the virus. So you can use a drug that inhibits the M2 ion channels. Okay, so if you inhibit the M2 ion channels, you prevent entry of low pH ions into the virus. And if there is no entry of the low pH ions, if the pH doesn't go down, uh, this prevents the conformational change from happening, right? So if there is no conformational change, there is no bending of the HA1, so there is no membrane fusion because the fusion peptide will not be exposed. So this prevents the release of the genomes from the capsid. Okay? Examples, amantadine hydrochloride and rimantadine. So actually you can also use this as prophylaxis for influenza A. You can also have a drug that blocks neuraminidase, right? So if you block neuraminidase, there will be no protein to cleave sialic acid and detach the newly formed virions from the cell after budding. So there are new virions, but they are not released from the original cell. Okay? So they will not be able to infect other cells. Example, zanamivir, oseltamivir, and peramivir. So these can be used for both types A and B. Now, prevention. The primary means of prevention is the use of inactivated viral vaccines. Okay, so federal bodies of the WHO make recommendations every year as to which strains should be included in the vaccine. The vaccine is usually a cocktail that contains one or two type A viruses and one type B virus of the strains isolated in the previous outbreaks, or actually the previous winter outbreak. However, this is made more difficult due to the antigenic drift and shift, meaning vaccines have to be made every time an outbreak occurs. But in healthy adults, the vaccine provides around 70% to 100% protection, but not so much in elderly and young children. Annual flu vaccination is recommended for all children 6 months to 18 years old. It's also recommended for high risk groups, those that have increased risk for complications if they get the flu, and for persons who might transmit influenza to these high risk groups, for example, medical personnel and household members with high risk companions. But of course, the simplest way is through cough etiquette and frequent hand hygiene. So, since these are the major modes of transmission.